Hello, everyone, and welcome to Scrubbed In and Speaking Out. I'm Yvette Coffey, President of the Registered Nurses Union, Newfoundland and Labrador. So we're right in the middle of a 2025 provincial election campaign, and we've invited each of the party leaders to join us and speak directly to you, our members, and the public about their vision for nursing and our public healthcare system in Newfoundland and Labrador. So today I'm joined by Jim Dinn from the New Democratic Party. And welcome, Jim. Thank you for being here.
Thank you for having me.
And we really appreciate you taking the time to talk directly to nurses and to share your party's vision. So that's where we're going to start. What's your vision for the future of not just nursing, but for our public healthcare system in Newfoundland and Labrador?
Well, I believe, in a publicly funded, publicly administered public healthcare system and the nurses within that. And we start by addressing the issues that are driving nurses from that profession into the private sector, or are keeping them from entering it. It's interesting, my first or second time running, I ran into a nurse who was casual, and I asked, I guess you're looking to be on full time, and her response astonished me, because no, I'm casual, because at least, I asked why. She said, well, at least I have control over my schedule, and when I go in and when I don't. Now, from a teacher's point of view, we're all looking to be full time, so that answer astounded me in many ways. And then I've heard, you hear again, certainly the issues that you brought forward, that your predecessor brought forward, and we can start to see the issues haven't been addressed. I would say they've been compounded by the use of agency and nurses, when that money could have been put into addressing the issues in the extra pay for the nurses within the system, to get them to go to areas that might be in need of help, or to at least, and I go back to some of the issues you've raised, similar to teaching, by the way, like violence in the workplace. So we used to say, and I used to say as NLTA president, that the working conditions of teachers is the learning conditions of your of your students, and I would say that the working conditions of nurses then are the recovery conditions of the patients in the system. So my vision, public, let's fund it public, let's put the money there and address the issues that are still facing nurses and healthcare professionals in the system.
Okay, so to add on to that, like you said, I've been very vocal in the public about the issues in the workplace. So you have your high workloads, you have your unsafe staffing ratios, we would call them. We have mandated overtime, 24-hour shifts. What if you form the next government here in Newfoundland and Labrador, provincial government? What would your government do to make sure that nurses can provide safe, quality care without the burning out on the other end?
So, and I have a question for you on that one.
Okay.
But I'm going to start out with, we have heard over the last, 4 years, we have demanded a sunset date on the nursing and ending the nursing agency approach. Okay. And I guess in the past we'd always be, we'd be accused of, where we're getting the money. Well, we're finding a lot more money to pay agency nurses and agencies to hire nurses, and working side by side with the full-time nurses who are within the public system, which, if anything else, I would say, if it were from my point of view as a teacher, it must be devastating to morale in many ways, because they've got the choice that many nurses would want. But so I think, first of all, if we've got that money for agency nurses, surely a fraction of that, even half of it, even could be used in the system to address the issues facing nurses. But I'll go one further. Like, you mandated overtime. I don't know what good a person is if they worked a 12-hour shift and they're mandated another. In industries such as airline pilots, truck drivers, there's mandated rest periods. There is no right way around it because there's a safety concern. And that affects patients, but I won't use the expletive, but crap does roll downhill, and it falls on the person at the bottom. So from my way, you say that the teachers, you've got to make sure that you protect yourself and your students. So my question is this: what would be the solution from your point of view to the mandated work time? What would you like to see? Because from my point of view, I guess I'd like to see, when it comes to management decisions, I don't know who's making these decisions, but having a seat at the table of nurses actually in the field and mandating that, being able to schedule and so on and so forth. But if you've got people who are at the table, who are on the front lines, surely their input will be into finding solutions. But if it's top down, there is an issue there, because I don't know if they're thinking about that nurse, or when they're into their 20th hour, and they're trying to deal with a patient who has complexities, may be difficult or whatever else. It's a safety issue. So I'm just thinking here, like having a seat at the table when it comes to management decisions. Is that something that could work? Because that's something I would be willing to explore.
So right now it is a top-down decision.
Yeah.
So, but you have a manager. So you're on a particular unit and you don't have staff for the next shift coming on. I mean, patients have to be cared for, right?
Yeah.
But what we're saying is listen to those frontline right there and then. I practice on my license.
Yeah.
Jim Dinn, as a registered nurse, practices on your license. If you feel that you're not fit to adequately provide that care safely and competently, the onus is on you then to say, I need a rest period, I need what, blah, blah. What we have been advocating for and talking about is we need to address the shortage. We need to address the violence in the workplace. We need to have safe hours of work, to have proper ratios, so that, if we talk about the staffing levels, so we have a core staffing review that's now getting started this fall. That should tell us that we need more registered nurses or licensed practical nurses, skill mix on a particular unit or a particular site. We have to remember that 40 years ago, when you went into the hospital to have a knee surgery, for example. So I had my ACL reconstructed on my knee back in 1992. Okay. I was in hospital for 2 weeks. By the end of that 2 weeks, I was basically rehabbing then, getting ready, up physio, going. Right now, that's outpatient. Gallbladder is outpatient. So the patients that are in the hospitals now are the sickest of the sickest. So we need to base staffing on the acuity of those patients. And our core staffing review that is now started, which is due to get done, should be done by the spring, should give us the numbers and the skill mix, and they will be increased to match the acuity of the patients we're seeing today. And I guess what we're asking each of the parties is, are you going to implement those recommendations from that core staffing review to say, okay, you now need 3 registered nurses, 2 licensed practical nurses on this particular unit at the health science, versus you only had 2 registered nurses and 1 licensed practical nurse prior to the core staffing review, based on that decades-old data. So we're looking for a commitment, or what would your party do once that core staffing review is done and the recommendations come out?
Let me put it to you this way. Yes, that would be. I can't argue anything but, because I'm looking for the same thing when it comes to teachers. Again, you look at the needs of the children in front of you. Mm-hmm. Having had relatives who are in the hospital, I can see what the effect is when you don't have enough staff there, especially when the patients are there. They're not most people in hospital, they're not there because they've got a scratch on their finger, or they're complex needs and they're multiple. So they're there for a reason. There's a reason I don't want to be there. Okay,
Exactly.
and if I end up there, it's a serious problem. So one of the things I guess we asked for one time. We used to ask government, have you even done an exit interview with the people who are leaving to find out why? And they haven't, and which is troubling to me, because I think they start to find out that the issues that you're talking about are the issues that are driving from that.
Yeah.
So my only concern with the review is that we'll have a review, we'll have recommendations, and it'll sit on the shelf until something happens. And I would find this, be honest with you, Yvette, in education, keep in mind that the whole Education Accord NL
Yes.
started as a result of yet another incidents of violence being reported in the classroom. So 18 months later, we've got a flawed report, I would argue, because we've got I guess this, the whole thing about false or fictitious references. And I'm thinking, oh my, I'm looking at it, yeah, everything makes sense. We've heard it all before. You just haven't done it. I know in talking to doctors in one and nurses in one hospital, that it's not the lack of the hospital that is need fixing or replacing. You can probably guess which one I'm talking about now. It's the fact that also, as one health professional there said, if you could free up the beds, you've got a lot of beds, acute care beds, are being taken up by people who should be in long-term care. So if you want to start again addressing the needs, you start focusing on solving. You start looking at the human resources piece, and I've always said that. So from anything, if there's a core staffing review, then for God's sake, it can't be any more expensive than paying for a nurse for the nursing agencies. If you can't have, you're certainly not going to have someone renting out rental properties at well 3 times the market price. You're you're going to be, actually, to me, why not put the benefits into the professionals we have to attract people back to it. Address the issues of violence. Then I think you're going to find that people, okay, I can enjoy this job. I don't think any nurse, any health professional leaves the profession because they hate the job. I think they love the job, working with people, but it's everything else that comes on it, the imposition, the mandated overtime, the fact that you can't get time off to be with family for a birthday or travel, just to have that moment of rest. I see in one of the I see sometimes now in one of the emergency wards that the sign is up there with regards to, if you see staff on cell phones, they're probably checking for data, and so they're not just they're not just scrolling through.
Yeah.
But to me, that speaks to the fact that to the pressure, the enormous pressure that they're on, in that people are watching them. And where does the blame go? The blame goes right to that health professional on the front line. And so to me, so they're under significant stress. How do you address that? Then you address it, as you said, when it comes to the core staffing review. The other part is, there are people in the emergency ward who really probably should have another alternative other than the emergency room. Like, I don't know, family physician, collaborative healthcare clinic, whatever you want.
There's a nurse practitioner for that.
Nurse practitioner for that. And by the way, that's who, I don't have a doctor, but I have a nurse practitioner. And so far, I'm very pleased.
So that's the other thing. There's a couple.
Yeah.
So one is, where are you to with student nurses? So either paying for their practicums, or we're hearing about tuition relief. So that's one.
Yeah.
And making sure they're all offered a permanent full-time position, just like the ones in, like, Nova Scotia is doing.
Yep.
Every single new graduate that's graduating in 4 years, like up to 4 years' time, are offered a permanent full-time position, wherever you want it.
Oh my God, no problem. I'll start with the paid work terms.
Right.
Always been a source of contention with me, I guess, as a teacher, because guess what?
They don't get it either.
You got, and here's how I look at it. You got 3 professions. You got teaching, nursing, social work. predominantly
Like
female. Okay. And I, as a teacher, we'd have student teachers come in, and they wouldn't get paid. They'd be paying tuition too.
Yes.
At one time, teachers used to get an honorarium for supervising, and that money would be turned into the classroom for supplies and so on and so forth. Then they took that away, and my point is, okay, you're taking the teachers doing the work for the evaluation, the student teacher is doing the work and doing the instruction. The student teacher is obviously sometimes still paying tuition,
Yep.
and sometimes has to work another job just to pay the bills. Okay,
Yep.
so my thought was, hell, just cut out the tuition. If we're doing this, then they shouldn't have to pay tuition. But from our point of view, and we've clearly laid this out, all work terms should be paid. And we had a release on this with regards to nurses, that they should be offered paid work terms. And for the simple reason, you're sending a clear message that all work has value, but also your work has value,
Right.
and we value what you're doing. This is not something that's we'll depend on your sense of vocation to the patients. No, you deserve this. The other part of it is I don't know how many times I've heard of nurses being offered contracts only to find out they're part-time casual. I have an issue with even in teaching these what I would call fractional units, and where you're not going to get people to go out and establish a life or whatever else in some community where you may have a part-time job, you may only be hired on for 3 months. Where do you go after that? And I can't help but think that if we didn't have the agency nurses there, we'd fill these with full-time contracts from the get-go. So, like I said, to me, the spouse of my cousin, she was a nurse practitioner and retired, but at the same time, I find this is certainly an answer to certainly a large part of the answer to the issues we're facing. I get very good health care, but I will say this, starting with our young students who are coming in, they should know that when they start the program that there's a job going to be waiting for them.
Yep.
The other part of this is you start that relationship early with recruitment, and you don't wait until the last year, but you develop that relationship with them from the get-go. And that's one of the things we're proposing in our platform. The other one is, like, when it comes to the recruitment, we've looked at, we're proposing like restoring the recruiter for the non-medical for the doctors, but also making sure we have one for nurses, and another one for all health professionals. Put them into one department so they're not working against each other, but you have a coordinated plan. But it's about making sure that we're attracting people. I think police, RNC officers, when they go into cadet training, they have a job waiting for them.
Yeah.
So from my point of view, unless you're going to tell me that we've got a surplus of nurses, then I think this is practical.
So nurse practitioners, we know there's 40, 50,000 Newfoundlanders and Labradorians who do not have access to primary health care. So because of that, it's a domino effect, and we have your overcrowded emergency departments. You have your long-term care, your patients who either need long-term care or they need some kind of altered level of care, like it might be personal care, home long-term care, or we might be able to get them home with support. So home care workers who are not paid appropriately, in my humble opinion. Early childhood educators when it comes to educating our children and getting at children. You talk about Health Coordinal and everything. One of the recommendations out of Health Coordinal is about children. And children in Newfoundland and Labrador, we have low percentage children, high needs.
Yeah.
So the next thing I want to ask you about is consultation. And I'm sure everybody saw the news past week about the consultation that unions had with NLHS about the rollout of EPIC. You know, there's a lot of talk around respect, around collaboration, with not only unions, but with the people on the front line. They're the ones coming with solutions. They're the ones who are saying, we need childcare if you want me to take a permanent full-time position. Well, guess what? If you want childcare, we're going to have to sign on for the $10 a day childcare, but we're going to have to pay early childhood educators appropriately, right? And this is my social activism part coming in here now. The same way with supports in school for children with special needs and high medical needs. But also those supports in the healthcare system. And we're not seeing those supports. So are you willing, your party, to be collaborative, consultative, with not only the unions that represent registered nurses and nurse practitioners, but with our front line, the people who are coming with solutions that we then bring forward? And we will be going into collective bargaining next year. Our ask is for good faith bargaining of any party, whichever party is going to be in there. But at the end of the day, it's to improve the working conditions of registered nurses and nurse practitioners,
And
which in
and conditions
turn
of patients.
improves health outcomes for Newfoundlanders and Labradorians. And one of those recommendations coming out of the Surgical Backlog Task Force, which I was on, was paid practicums for nursing students. It didn't make it to the top of the list, but it's already recommended elsewhere. There's studies that show that nursing students, the biggest barrier is financial.
Yep.
I came from the old school. We got a stipend. We had our accommodations. I lived in Southcott Hall
Yeah.
on the 12th floor and the wind blowing through. It was cold. But we were respected.
Yep.
We knew that we were valued. And I do like the way you have put that about the respect and value. But would your party be willing to keep that attitude going and that momentum going into good faith bargaining to improve the work lives of nurses in
A
this
lot to
province?
unpack there, but I want to start with one thing first. You talked about schools.
Yes.
When I first started teaching, we had public health nurses in the system.
Yes, and we still should.
And we still should. And I would say my wife taught primary. When I taught in elementary, and I've noticed over the years, like you see the cutback and the and even having that health professional there who was regular, who was known, was a tremendous help to the well-being,
remember.
right? And I can tell you, like, yet we've seen the cuts, and I know it makes no sense because they go hand in glove with the educator there.
Yep.
Often I would say that at the school level, it's going to be the teacher sometimes who first might identify if there's something not right with the eyes. It's going to be or the hearing or whatever.
Yep.
It's going to be the nurse that they're going to consult. So I will say there at some point, I think we really need to start looking at bringing the nursing profession back into the school system. But
One of the recommendations of Health Court.
you got it. So to me, it's because it takes that village to raise a child. Okay.
Yes.
And with OTs, you name it. We can have better, if we want better health outcomes. It doesn't mean building more hospitals or bringing in more equipment. It comes down to that human aspect. But to get to your point of consultation, it's a sore point for me because I will tell you, I was NLTA president, and I always loved when what consultation usually meant. So here's consultation, Jim. We're releasing this thing tomorrow, and call you in for an hour the day before, sometimes an hour before they're going to release it. But they can claim then that they consulted with the NLTA like hell. Okay, it was a total lack of respect, and I've seen it play even when they raised it in the House of Assembly. When they talked about consultation, my usual response is, I know what your definition of consultation is. It's checking off a box. You have no intention. You want to be able to say, well, you consulted, and therefore we had the support of. And many times, you know yourself, I've probably called you and said, here's what they're saying, only to find, okay, and you said, no, it's not really what happened. Good enough. I just need to make sure that
We were informed.
we were informed. So my first thing, I guess, and it comes from my own union background, and the belief that the people on the front lines know how the system works, and they can and they have good knowledge. They are professionals. Okay, there's a standard which they set for themselves. You don't need, in many cases, nurses, doctors, health professionals, teachers. There is a standard that they set for themselves. So as simple as that. Then for God's sake, listen to it. And that means you don't have I don't know who makes some of the decisions, by the way, and even when it comes to the school system, I still have scratching my head. I can only imagine that in the healthcare system, it's the same thing as to like who came up with the notion that mandated overtime. I would like to think at some point that when you look at the agency nurses, they had a short-term problem or whatever else, and they said, well, we'll hire agency nurses. And that became the panacea. That became the default position. And in other words, then they got lazy and they didn't fix the problem.
Yep.
They didn't address the problem. They didn't consult. They didn't collaborate. So from my point of view, I don't think we would have half the problems if there was meaningful collaboration and consultation. And I don't know if there's a political agenda at the level. I don't understand it. But to me, if you got people working in the hospital, then there's a way of addressing it. I look at everything, whether it's the freezer, the unclaimed bodies in freezers. I can tell you that didn't just crop up. That was a decade or more in the making, and I can guarantee you that there were people at the funeral home level, at the professional level, identifying this, and guess what? They ignored. So from my point of view here, and certainly the point of view of the NDP, yes, if we want to avoid the problems we have, then you start talking to the union. And by the way, when we talk about frontline workers, it's not about doing an end run around the union. It's about making sure that we have, we have that. I think nurses, health professionals at the table when it comes to decision making. That's the only way, and like have something with not just an advisory body, but one that can make good recommendations and informs the decision making.
Well, Jim, thank you for joining me today and
you for
sharing your party's vision to our listeners, especially registered nurses, nurse practitioners. You can find all the party responses because we have reached out to the three parties and with a set of questions. And they've all complied and given us their answers. So you can find them on our website, rnunl.ca. I'm Yvette Coffey with the Registered Nurses Union, Newfoundland and Labrador. Thank you for tuning in to Scrubbed In and speaking out.
Thank you for having me.
Thank you.
Appreciate it.